We've all heard the name Parkinson's disease. But beyond the tremors, how much do we really understand? What does it actually mean when someone is diagnosed with Parkinson's disease? How does it start? What early symptoms should you be watching for, either in yourself or someone you love? Today, we're going to break it down in a way that makes sense. No overwhelming medical jargon. Because early recognition of Parkinson's disease can lead to earlier care, better quality of life, and less confusion. Let's talk about what Parkinson's really is, and how to recognize the early signs before they escalate. Parkinson's disease is a progressive neurological disorder. That means it affects the brain and gets worse over time. At its core, Parkinson's disease is a condition that disrupts how the brain controls movement. It happens when nerve cells in a part of the brain called the substantia nigra start to break down or die. These cells are responsible for producing dopamine, a critical chemical messenger that helps your brain coordinate smooth, controlled movements. When these dopamine-producing cells decline, communication in the brain becomes scrambled. Movements become slower, shakier, and more rigid. But Parkinson's isn't just a movement disorder. It also impacts mood, sleep, cognition, and even digestion. And it doesn't happen overnight. The changes often begin subtly, making early detection both difficult and incredibly important. Like many chronic illnesses, Parkinson's disease doesn't show up all at once. It tends to whisper before it shouts. And because the early signs can be easy to dismiss or even misdiagnose, people often don't get the support they need until the condition is more advanced. But the earlier Parkinson's disease is recognized, the sooner someone can start treatment. And while there is currently no cure, early intervention can slow progression, improve symptom management, and dramatically increase quality of life. That's why learning to recognize the early indicators isn't just helpful, it's potentially life-changing. Let's start with the early motor symptoms, the ones that show up in how a person moves, walks, or gestures. These are often the signs people think of first when they imagine Parkinson's. Number 1. Tremors at rest. This is one of the most recognizable signs. A person may notice a slight shaking or twitching in a hand or finger when it's at rest, not when it's in use. It might look like the fingers are rubbing together in a motion known as pill rolling. Number 2. Bradykinesia. That's a fancy word for slowness of movement. It might show up as taking longer to do everyday tasks. Buttoning a shirt, tying shoelaces, even getting up from a chair. The person doesn't just feel tired, their movements are physically slower. Number 3. Muscle rigidity. Stiffness in the arms, legs, or neck can appear, often without pain. The stiffness doesn't go away with movement and may limit a person's range of motion. Number 4. Changes in posture or gait. You might notice a stooped posture, shorter steps, or a shuffling way of walking. Arms may swing less on one side. These subtle movement changes often go unnoticed at first, but they're key early signs. Number 5. Smaller handwriting. A lesser-known sign is a noticeable change in handwriting called micrographia. Letters may become smaller and more cramped over time. Let's now discuss the non-motor early symptoms. What surprises many people is that non-movement related symptoms often appear years before the more classic tremors and rigidity begin. These early clues are often misunderstood, but they can be the first red flags that something is shifting in the brain. 1. Loss of smell, anosmia. Many people with Parkinson's disease experience a reduced or total loss of their sense of smell, sometimes years before other symptoms begin. If you or someone you know suddenly can't smell foods, perfumes, or other strong scents, and there's no clear reason like allergies, it could be an early warning sign. 2. Constipation. Parkinson's disease can affect the autonomic nervous system, which controls digestion. Frequent constipation, especially when it becomes a persistent issue without dietary explanation, is a commonly overlooked early symptom. 3. REM sleep behavior disorder. This is when someone physically acts out vivid dreams, talking, kicking, or punching in their sleep. While many people never connect this to a neurological issue, it's been shown to precede Parkinson's disease by years in some cases. 4. Mood changes, depression, apathy, or anxiety, sometimes in people with no prior mental health history, may emerge before any motor signs. This is not just stress. It's a reflection of changes in dopamine and serotonin pathways in the brain. 5. Soft voice or facial masking. A soft, low-volume voice or a loss of facial expression, sometimes described as having a flat or emotionless face, may also appear early, subtly making social interaction more difficult without the person realizing why. So, who gets Parkinson's disease? While Parkinson's disease is more common in people over the age of 60, it can also occur earlier, a condition known as young-onset Parkinson's disease, which can affect people in their 40s or even 30s. Genetics may play a role, especially when there's a family history, but most cases are sporadic, meaning they occur without a clear inherited cause. Certain environmental factors like prolonged exposure to pesticides or head trauma may increase risk, but the exact cause is still not fully understood. What to do if you notice these signs? If you or someone close to you has been noticing symptoms, whether they're physical changes like tremors and slowness, or more hidden ones like mood shifts or sleep disturbances, the most important next step is to talk to a healthcare provider. Usually, a neurologist will perform a clinical assessment, sometimes with brain imaging, to help rule out other conditions. Early diagnosis doesn't mean rushing into heavy medications. It means getting a clear picture of what's happening so that treatment, support, and planning can begin. Early care often includes lifestyle changes, physical therapy, and medications that can dramatically improve quality of life and preserve independence for much longer. Parkinson's disease doesn't always announce itself loudly at first. Sometimes it arrives quietly, a hand that shakes when no one's looking, a walk that becomes slower without anyone noticing, a voice that softens before the person does. But those early signs are meaningful, and knowing what to look for means you can respond sooner, with clarity, not fear, with action, not delay. Because Parkinson's disease doesn't just affect movement, it affects the whole self. And early awareness can make all the difference in how someone lives, moves, and thrives through the journey. If this helped you understand Parkinson's more deeply, consider sharing it with someone you love. Awareness is powerful. And when we talk about it, we help others feel less alone. Don't forget to check out our other mental health education videos.